On behalf of the entire Navy medicine team, welcome to America's Navy. I'm Captain Shauna O'Sullivan, lead for the Surgeon General's line of effort, recruitment and retention.
And I'm Captain Brian Feldman, the Deputy Chief of the United States Navy Medical Corps.
We're incredibly excited to have you on board. We want to ensure you have everything you need to succeed in your naval career. This video introduces you to the key tools and resources available to you.
Greetings, I'm Captain Brian Feldman. It's my privilege to give you an overview of life as a Navy physician. The Navy's Officer Development School, or ODS, is a 5-week initial military training program for newly commissioned officers. The purpose of ODS is to provide foundational knowledge and skills necessary to be effective leaders and officers in the United States Navy. The training occurs in the Officer Training Command Newport in Newport, Rhode Island. The academic curriculum focuses on the following: basic military subjects such as orientation to Navy culture, uniforms, customs and courtesies, military law, and physical readiness. As Navy physicians, you will be leaders. The coursework includes topics on leadership development. You'll learn about the importance of ethical decision-making, followership, and team dynamics, and part of what we call the Navy ethos. The Navy ethos represents the core values and principles that guide the behavior and decision-making of all members of the United States Navy. It is a framework for moral and professional conduct, emphasizing honor, courage, and commitment. Our Navy ethos calls on every sailor to be a person of integrity and honesty, to have the courage to do what's right, even when it's difficult, and to be committed to the excellence and success of the Navy mission. It's more than just a set of words. It's a living code that shapes the character and actions of those who serve in the Navy. You may not just be working in a hospital in your Navy career. You'll be oriented to some of the unique places where we care for patients. You'll have shipboard organization, damage control, and the principles of watchstanding that your patients live on a day-by-day basis. You'll learn about the resources for professional development to include career planning, financial management, and stress management. In summary, ODS serves as a standardized and intensive introduction to naval life, leadership, and core competencies for officers entering the Navy from various commissioning sources. It bridges the gap between their previous experience and the demands of serving as a naval officer. Graduates of ODS will possess the basic knowledge, skills, and mindset to successfully transition to their respective Navy communities and begin their careers as effective officers. The Navy's Physical Fitness Program is a comprehensive program designed to ensure sailors are physically fit, healthy, and ready to perform their duties with an emphasis on health, wellness, and resiliency. The program includes continuous support and resources for those who need it. Key aspects of the program include a semi-annual physical readiness test, or PRT. This includes body composition assessments and a physical fitness assessment. Passing scores are required and are adjusted for age. A fitness enhancement program is available for sailors who are unable to complete the PRT or BCA successfully. This program provides dedicated work time and structured exercise and nutritional guidance to help them succeed. We emphasize a year-round fitness culture. Commands encourage daily physical activity and healthy dietary habits, not just preparation for the PRT. Resources and education are available on nutrition, exercise, and healthy lifestyle choices. Finally, the program is managed by command fitness leaders. These are trained personnel who manage fitness programs at the command level and provide guidance and support to sailors. In addition to your military chain of command, there are 2 important officer resources to support your career management and advise you on professional growth and development. A detailer is the person responsible for managing the careers and assignments of a specific group of officers or enlisted personnel. They are the career managers within the Navy personnel system and serve as your advocate. Think of them as the HR specialists within the Navy, but with a focus on career management and assignment. They are crucial in ensuring the Navy has the right people with the right skills in the right places at the right time. Each physician is also supported by a specialty leader. Each medical specialty has an officer who serves as a subject matter expert on all community issues and provides mentorship and advice to each officer while managing the specialty community. While they serve in an advisory role, final assignment decisions fall to the detailer. Building relationships with both your detailer and your specialty leader are crucial in ensuring you have a successful and fulfilling Navy career. An integral part of Navy medicine's mission is to support operational forces. In this role, physicians may be expected to formally deploy or support shorter-term temporary additional duties. Deployments are focused on providing direct medical support in the field. They can include training opportunities and real-world experience in austere environments. The length and location vary by specialty unit and mission, but are typically longer in duration. They are an opportunity to experience different operating environments and develop close relationships with operational personnel. In contrast, temporary additional duty, or TAD, involves the following: assignments to other locations for a specific purpose and limited duration. This can be for training, conferences, short-term staffing needs, or special projects. They can be variable in length, from days to several months. Reimbursement for authorized travel and lodging expenses are included. Examples include attending a specialty course, assisting with a surge of patient loads in another treatment facility, or supporting a humanitarian mission. In the next few slides, I'll summarize the Navy pay and benefits system. In addition to your monetary compensation, active duty physicians receive full health care benefits inclusive of family members, tax-free housing allowances, life insurance coverage for both the member and spouse, and the ability to contribute to a program called the Thrift Savings Program, or TSP, analogous to civilian IRAs or 401ks, with either pre-tax contributions or an after-tax Roth contribution savings program. TRICARE is the comprehensive health insurance program for physicians and their families. Multiple plan options are available. This provides very robust coverage with no or very low out-of-pocket costs compared to the civilian insurance system. Comprehensive dental coverage is also available to the officers and their families. Finally, families receive commissary and exchange privileges with access to discounted goods in military stores and the ability to travel for free if space is available on military aircraft. The first slide reviews something called the Leave and Earnings Statement, or LES. This is updated monthly and summarizes your pay and benefits. You will be able to access your pay through the Navy's MyPay website. The Navy LES contains the following information: your monetary entitlements, allotments, and tax withholding, as well as your leave balance. Service members accrue 2.5 days of leave per month for a total of 30 days per year. You can bank up to 60 days of leave without losing days, and in some cases of deployments, bank even more. On the left column, you will see your entitlements such as your base pay, which is determined by your rank and years of service. This compensation increases annually with cost of living increases and every 2 years with accumulated service time. You will also receive a basic allowance for housing, or BAH, which is a non-taxable allowance to cover housing costs. This varies based on your rank, your duty station, and dependency status, i.e., if you have dependents, you get a larger amount. You'll additionally receive a basic allowance for subsistence, which is a non-taxable allowance to offset the cost of meals. This is a standard rate for all officers. Navy physicians also have the opportunity to receive a variety of special pays, which are published annually after approval by Congress. This is where the differences that can come for physician compensation. Several types exist, which will be summarized in the next slide. Navy accession bonuses are a recruiting tool for specific physician specialties. Generous accession bonuses are published annually for critical wartime specialty needs. Incentive pay, or IP, is an annual incentive based on the specialty and length of service. It is higher for certain high-demand specialties. Board certified pay is an annual flat rate provided for being board certified in a recognized specialty. Lastly, a retention bonus is available to physicians who agree to extend their service commitment beyond their initial obligation. Finally, I'll review some additional benefits, including retirement savings contributions. The blended retirement system combines both a defined benefit upon 20 years of service with an ability to contribute to retirement with matching funds from the Navy that go with you upon separation before 20 years of service. The Navy matches your TSP contributions, and vesting occurs after only 2 years of service. Continuation pay is also available at mid-career points with a 4-year commitment. You can learn more about these programs via the links on the slide. A Navy Permanent Change of Station, or PCS, is the change of assignment of an officer from one duty station to another for an indefinite period. It involves relocation of the service member and often their family to a new geographic location. It is a routine part of military life designed to meet the operational needs of the Navy. Here's a breakdown of the key aspects. A PCS is initiated by official orders from the Navy outlining the new duty station, reporting dates, transportation entitlements, and other important details. Relocation involves physically moving the service member, their household goods, and potentially their family to a new duty station, all paid for by the Navy. The Navy provides various entitlements to help offset the costs of a PCS move. These include transportation of your household goods. The Navy arranges and pays for the transportation of the service member's belongings. Dislocation allowance, a lump sum payment to help cover the expenses related to setting up a new household, temporary lodging expense, reimbursement for lodging and meal expenses incurred during the move. PCS orders are issued for a variety of reasons, including career progression. This allows promotion or assignment to a more challenging position, operational needs, filling billets at different commands or ships, training, attending specialized schools or courses, and rotation, periodic relocation to a different geographical area. The Navy and your detailer attempt to consider family needs when issuing PCS orders, but operational requirements often take precedence. PCS moves require careful planning and coordination, including arranging for housing, schools, childcare, and other essential services in the new location. Resources are available to help service members with this process in the links below. The Navy's physician privileging process is a comprehensive system to ensure patient safety, high-quality care, and ongoing competence of its physicians. This process provides core privileges that enable doctors to perform both operational duties and standard clinic-based or hospital care. The core principles of Navy privileging are as follows. Physician credentials are viewed via primary source verification, which occurs via a certification organization. Physicians must complete a standardized application that covers education, training, licensure, experience, and other relevant qualifications. Physicians will request specific privileges based on their training and experience. The department reviews the application and requested privileges, verifying competence through peer recommendations, documentation of experience, and potentially proctoring. Privileges are not permanent. Periodic reappraisal, now every 3 years, and upon times of rotation, is required to ensure continued competence and fitness to perform granted privileges. This involves a review of performance data, peer recommendations, and currency. Ongoing monitoring of physician performance through various mechanisms is critical to identify any areas of concern. Other key components analogous to civilian processes include the requirement to have a valid and unrestricted license to practice medicine. With rare exceptions, Navy physicians can choose to be licensed in any state. Board certification is strongly preferred and often required, especially for certain specialties, and is an important factor in promoting to senior ranks and serving as teaching faculty. Continuing medical education, or CME, must be maintained in accordance with your licensing requirements. Specific Navy privileging may have additional requirements due to the operational requirements and may be more stringent than civilian standards. For example, our subspecialists maintain core privileges in their base specialty in order to serve in operational roles, and as teaching faculty in our graduate medical education training centers. Specific considerations for Navy physicians include the fact that some specialties also need to demonstrate competence in military-specific procedures or aspects of practice. All physicians are expected to be medically and physically ready to deploy and support operational missions. Lastly, I'll highlight that Navy physicians are supported by a Medical Executive Committee, or MEC, who manage the policies and procedures for practice and advocate for physicians. In summary, Navy physician privileging is a rigorous process that prioritizes patient safety and ensures that qualified and competent physicians are granted the privilege to practice medicine within the Navy healthcare system. It involves a thorough review of credentials, performance data, and ongoing monitoring to maintain high standards of care. Lastly, the system builds support mechanisms to optimize physician success. Navy physicians serve in a wide range of roles, each with its own set of responsibilities and challenges. Navy physicians utilize a global electronic health record system known as MHS Genesis, which contains the comprehensive health records of all beneficiaries. Here are some examples of the many roles of Navy physicians. Traditional clinical care in Joint Commission certified military treatment facilities, as well as integrated care in both VA and civilian partnerships. Primary care physicians provide comprehensive medical care to sailors, Marines, and their families in clinics and hospitals. They manage chronic conditions, treat acute illnesses, and conduct routine checkups. Specialists provide medical care in their respective fields, often working in larger military treatment facilities or civilian partnerships. They may perform surgeries, diagnose and treat complex conditions, and conduct research. Emergency medicine physicians respond to medical emergencies in hospitals, on ships, and in deployed environments. They stabilize patients, initiate treatment, and coordinate further care. Behavioral health professionals address the mental health needs of service members, including PTSD, depression, anxiety, and substance abuse. They provide therapy, medication management, and crisis intervention. Navy physicians practice in some of the world's most unique operational environments. Flight surgeons and aviation medicine specialists provide medical care to naval aviators and aircrew, ensuring their fitness for flight and investigating aviation accidents. They are often trained in aerospace medicine. Dive medical officers are specialized in diving medicine and treating diving-related injuries and illnesses. They ensure the health and safety of the Navy diving community. Undersea medical officers deal with the unique medical challenges of submarine environments, including hyperbaric medicine and radiation exposure. Battalion surgeons deploy with Marine Corps units. They provide medical support in combat and humanitarian assistance operations. They may treat battlefield injuries, manage infectious diseases, and provide preventative care. Ship surgeons serve on Navy ships and provide medical care to the crew and passengers. They manage medical emergencies, conduct sick call, and ensure the ship's medical readiness. Navy physicians also serve critical roles in leadership and administration. The Navy has medical directors that oversee the operations of hospitals, clinics, and other healthcare facilities. They ensure quality care, they manage budgets, and supervise medical staff. Program managers lead specific medical programs such as public health, disease prevention, and research. And commanding officers lead military treatment facilities and other medical commands responsible for the overall mission and well-being of the staff. Medical Corps officers serve in various levels within the Navy and Marine Corps, advising commanders on medical issues and shaping health policy. Navy physicians also serve in research and development. They conduct research on military-specific health problems such as combat casualty care, infectious diseases, and psychological health. They may work in laboratories, clinical research centers, or field research sites. Finally, Navy physicians serve as public health officers. Focusing on preventing disease and promoting health within the military community, they conduct epidemiological studies, develop health education programs, and manage public health emergencies. A Navy fitness report, known as a FitRep, is a performance evaluation document used to assess and document a service member's performance, leadership, and potential. It's a critical tool for promotions, career advancement, and assignment decisions. The purpose is to evaluate performance, leadership, and potential for promotion. The content of the report includes a rating of the performance against peers, highlights accomplishments, and provides narrative comments. FitReps are generally submitted by the reporting senior officer, reviewed by the member, and placed in their official record annually and on other occasions such as a change of commanding officer or a permanent change of station. All officers are required to receive midterm counseling in order to understand your goals and promote professional development and success. The next slide reviews additional tools to support your professional development and career management. Career development boards are periodic structured conversations and record reviews used to help officers develop goals and effectively manage their careers. Topics covered include the following: a review of the officer's performance documents such as FitReps, awards, the officer's service record and performance summary, which are used in the promotion boards, training and education opportunities, career goals and advancement, special programs and assignments, and balancing personal well-being and family needs with the career. When you receive orders, review them carefully as they will contain detailed instructions and resources on how to execute your transition to your assignment. You should receive welcoming information and be assigned a command sponsor to help coordinate your transition and arrival. They will help you with some of the formalities of joining your new command, including checking in, gaining access, badges, orientation, as well as meeting your leadership team and peers. Upon commission, these are your detailers who will reach out to you to help facilitate your first set of orders. Lastly, this slide provides a summary of links to many of the informational resources in support of your career as Navy medicine physicians. In summary, Navy medicine offers a rewarding career path for those seeking a combination of professional fulfillment, service to the nation, and unique opportunities for growth and development. It's a great fit for individuals who are passionate about medicine, dedicated to serving others, and thrive in a team-oriented environment. Your recruiter is a resource for answering specific questions. They will ensure your inquiries are directed to the appropriate Corps Chief's office for a comprehensive response. As Captain O'Sullivan stated earlier, we are excited for you to join the Navy medicine team. Thank you for your time and attention.